The bite is completely painless, and that is exactly what makes it so dangerous. By the time you feel anything at all, the venom has already begun dismantling your nervous system from the inside out. The black widow is the most venomous spider in North America. Drop for drop, her venom is roughly 15 times more potent than rattlesnake venom. And yet she weighs less than a paperclip. A spider so small you could lose her in the palm of your hand, carrying a weapon that can bring a full-grown adult to their knees within the hour. Here is what her venom actually does to you, minute by minute. It begins with almost nothing. A faint pinprick, a small red mark that looks like a mosquito bite, maybe not even that. Most black widow bites inject somewhere around 0.1 milligrams of venom. That is a microscopic amount. Not enough to trigger immediate pain, not enough to leave a dramatic wound. Just enough to start a chain reaction you won't feel for another 30 to 60 minutes. The spider herself has no interest in you. She bites defensively, when she's trapped against skin, disturbed under a log, or startled inside a shoe. She doesn't hunt humans. She doesn't seek confrontation, but when she feels cornered, she acts. And she lives exactly where humans reach without looking. Woodpiles, garages, outdoor furniture, garden gloves left on a shelf, the underside of a toilet seat in an outhouse, which historically made outhouses one of the most common bite locations in North America. For the first 30 minutes, you feel almost nothing unusual, maybe a dull ache beginning to build, a slight heaviness in the area of the bite. Beneath the skin, alpha-latrotoxin, the primary weapon in black widow venom, has entered your bloodstream. It is now moving through your body toward its target, the junctions between your nerve cells and your muscles. This toxin is extraordinary in a deeply unsettling way. Most venoms destroy tissue directly. They digest, they necrotize, they burn. Alpha-latrotoxin does something far more sophisticated and far more brutal. It binds to receptors at the nerve terminal and forces the nerve to release all of its stored neurotransmitters, all at once. Every chemical messenger, every signal, fired simultaneously in a catastrophic flood. Your nervous system has a volume dial. Alpha-latrotoxin doesn't turn it up. It rips it off entirely. Then the wave hits. It often starts as a dull, spreading cramp, not at the bite site, somewhere deeper. The abdomen, the lower back, the chest. Within minutes, the cramps intensify. The muscles in your abdomen begin to contract involuntarily. Your back tightens. Your legs may begin to shake. Sweating starts, sudden and drenching, without warning. This is latrodectism, the full-body syndrome caused by a black widow bite, and it is one of the most distinctive clinical pictures in all of toxicology. The pain radiates upward, into the chest, down the arms. Here is where the first truly dangerous mistake happens, because this presentation is nearly indistinguishable from a heart attack. Chest pain, radiating arm pain, sweating, elevated blood pressure. Emergency physicians have admitted black widow bite victims directly into cardiac units, convinced they were treating a cardiac event, not a spider bite, especially when the patient didn't see the spider and the bite mark is too small to find. By the first hour, without treatment, the symptoms have usually reached their peak. The muscle contractions have spread across the entire body. Jaw muscles tighten, facial muscles spasm, a grimace that doctors historically called rhizus sardonicus. The sardonic grin, also seen in tetanus. Blood pressure climbs dangerously, the heart rate spikes. Some patients experience nausea so severe they cannot stand. Others report a wave of anxiety, not just discomfort, but genuine, overwhelming dread, which is itself a physiological response to the neurotransmitter flood, not simply fear of the situation. The pain is described by victims as some of the worst they have ever experienced. Not sharp, not localized. A deep, crushing, full-body agony that sits at a 9 or 10 on the pain scale for hours at a time. Some historical accounts from before antivenom existed describe patients begging to be rendered unconscious simply to escape it. Here is what makes the black widow both terrifying and, in the modern world, rarely fatal. The venom, despite its potency, is delivered in such a small quantity that healthy adults almost never die from it. The fatality rate for untreated black widow bites has been estimated at around 1 to 5% historically. Today, with antivenom and supportive care, deaths are exceptionally rare. But the antivenom itself is not always the first choice of treatment. In many cases, doctors manage latrodectism with intravenous pain medications, muscle relaxants, and calcium gluconate to ease the muscle contractions. Antivenom is typically reserved for severe cases, the very young, the elderly, those with underlying heart conditions, because the antivenom itself carries a small risk of allergic reaction. The people most at risk are not large, healthy adults. They are the very old, the very young, and anyone with a compromised cardiovascular system. For those groups, a black widow bite without prompt treatment can be genuinely life-threatening. The female black widow is the dangerous one. The male, smaller, duller, rarely seen, carries venom too weak to cause significant harm in humans. She builds an irregular, tangled web close to the ground. She waits. She is not aggressive by nature. In a study observing black widow behavior, the majority of spiders, when repeatedly disturbed, chose to flee rather than bite. The bite is a last resort. She can live up to 3 years. She rarely leaves her web, and she is present across almost every continent except Antarctica, in North America, Europe, Africa, Asia, and Australia in various species. 13 species of widow spider exist worldwide. The southern black widow, the western black widow, and the northern black widow in North America alone. Every one of them carrying the same neurotoxic arsenal. For most healthy adults who receive treatment, recovery begins within 12 to 24 hours. The muscle contractions ease. The pain becomes manageable. The sweating stops. But the fatigue that follows can last days. Some patients report generalized weakness, headaches, and sensitivity for up to a week after the acute phase. The body has been through something extraordinary. Every major muscle group fired against its will. Every nerve terminal stripped of its chemical reserves. The spider, meanwhile, has moved on entirely. She has no awareness of what she set in motion, no malice, no interest in the outcome. She was simply defending herself. In a corner, under a log, in the dark. That is the paradox of the black widow. A creature responsible for more reported venomous spider bites in the United States than any other species. A spider whose venom is extraordinary enough to be studied by neuroscientists trying to understand how nerve terminals function. And yet one whose first, most powerful weapon is invisibility. The bite you don't feel. The venom that waits. The pain that arrives like a train you never heard coming. She doesn't need you to notice her. She only needs you to forget she's there. If you want to understand what other creatures are hiding abilities this extraordinary, abilities that push the limits of what venom can actually do, subscribe, because next time we're looking at a spider whose bite doesn't cause pain at all. It causes something far stranger. This one, 15 times more potent than rattlesnake venom. Confirm comparative potency by LD50, 2. 0.1 milligrams of venom per bite. Confirm typical injection volume 3. Outhouses as common bite location historically. Confirm historical record 4. Cardiac unit misdiagnosis. Confirm documented clinical cases 5. Rhizus sardonicus facial spasm. Confirm clinical terminology usage for latrodectism 6. Patients begging for unconsciousness. Confirm historical clinical accounts 7. 1 to 5% historical fatality rate. Confirm historical estimate range 8. Calcium gluconate as treatment. Confirm current treatment protocols 9. Male black widow venom insufficient for harm in humans. Confirm 10. Majority of disturbed black widows flee rather than bite. Confirm study reference 11. 13 species of widow spider worldwide. Confirm current species count 12. More reported bites in US than any other venomous spider. Confirm epidemiological data.